Dr. Gina. Welcome to our dental office. Here I'm sharing with you today our vision and what we're really passionate about so that you can learn how your oral health actually affects so many areas of your life. Our vision here at Calvert Smiles and Maryland Holistic Dentistry and Annapolis Green Dental, we have quite a few locations, is to love and serve ourselves and others through positivity and holistic health. That means that the mouth is connected to the rest of the body. Everything that's in the mouth, all the bacteria, all the inflammation, affect the rest of the body. It can affect your weight, it can affect your brain health, it could be linked to Alzheimer's disease, cancers, cardiac health, as well as many other autoimmune conditions. We have all kinds of supplements in our office and different homeopathic remedies that we can talk to you about so that we can keep your mouth and body as healthy as possible and keep you as positive as possible in life when you're feeling great and looking great. Lots of aesthetic and cosmetic options too that we're going to discuss in these videos that allow you to smile bigger, brighter, whiter, straighter, and allow you to have oxygen at night through preventing things like sleep apnea. So as you listen and watch these videos, if you have any questions, feel free to ask your hygienist or your dentist more, and we're excited to share our passion with you.
Smile makeovers, porcelain veneers. You do a lot of this in your practice.
Absolutely, because everyone wants to look good, healthy, and younger. It is the most, I guess, rewarding cosmetic procedure you can have, an instant improvement.
You say, well, I say, you look at least 15 years younger than your age. You've been practicing dentistry for 15 years. And you say it's because of your teeth.
Right.
Teeth can make you look younger?
Absolutely. I can take my patient that came in last week with the worst set of teeth ever, broken, gray, cracked. If you put them in my mouth, you would not say that I looked young. You would, you know.
Those same teeth in your mouth.
Right.
Okay.
Yeah. If you put them in my mouth, we wouldn't be sitting here talking. I probably would feel self-conscious. I wouldn't be up here even telling people to fix their teeth. I'd be fixing my own teeth. But yeah, you wouldn't look young. You wouldn't look vibrant. You wouldn't look full of life. So that's what changing teeth does. And people don't realize it too. But I know, like, even sometimes my husband, like, will be checking out in the grocery store and he's like looking like, what's wrong with their teeth? It's not that anything's wrong with their teeth. They're malpositioned. They're mal-shaped. They took medications that made them discolored. It's not like that one tooth, you know, like he's staring at, like, what happened to it? It's because of something that happened, and it's fixable. It's minor.
So if you don't like your teeth, you say do something about it.
Right, and it can be some people think, oh my gosh, I'm going to need a whole mouth of veneers and crowns, and they're going to have to drill all my teeth down to give me teeth that look good. It is not that, it's not that involved. It's very simple. You can replace a few crowns you have, you can put veneers in, you can just use ceramic and composite filling material to get rid of the areas that are broken, and you can shape the teeth to make them look feminine. I tell a lot of, again, this day and age where everyone's stressed and they've worn them down, people have worn down these square, old-looking teeth. Bring them back, make them round, make them full, pick a shade, a few shades lighter. You
say, for some people, when you change their smile, their life changes. Is that true?
Absolutely. Yeah, we've had, you know, one guy who came and he would talk like this. He would actually like almost sign language to us just because he had this tooth. Just that tooth was broken. Okay. Just one tooth was causing him to sign. He wouldn't talk to people. We did replace that with an implant, and that tooth looks gorgeous, and we fixed all the fillings on the other teeth. You know, it looked like he had gray and brown dirt in between every tooth. Once he got that done, he's out there. He's telling me about the friends he made, the librarian. He's telling me at the auto body shop. You know, like all of a sudden, he's at church. He's singing in the choir. You know, he's like, all of a sudden, he knows everyone. He's like, oh, I heard so-and-so. I don't know what he was doing before that. He wasn't getting out. Now, all of a sudden, he's the socialite of the community. So yeah, it's
all because of his teeth.
All because, right, before he didn't want to talk to people. He didn't want people to see, like, smile. And they're like, whoa, goodness, big black hole. You know, and what's up with everything else in between? So, right, it just changed his life so that he could be, he was always social. He just was not able to be social because of those
Do you believe that it's inevitable, if you want to look your best, that veneers are inevitable? That means if you always want to look your best in your 60s, 70s, because no matter how well you take care of your teeth, they're going to get a little dingy.
Exactly.
I said that, but do you believe that? That's part
I believe it so much. I'm pretty much have my appointment booked in about 30 years to get my veneers. I'm planning on getting them when I'm around 70.
Wow.
Because I don't want to look, I know I don't want to look 70. Call me vain. But I know at 70, I'm not going to feel 70, so I don't want to look that way, and I don't want the way I look to affect the way I feel. I know that, well, maybe my kids will have grandkids, but I know I'm still going to want to be out enjoying food and exercising and social engagements, and I don't want to look at that age. Now,
they'll say that about you behind your back. They'll say, she can't be old. Look at those
right,
teeth.
Look at those teeth. So I do think I don't want to say it's inevitable. There are a few people that have really, really white enamel. And again, coming into our office with our natural cleaning products, we can keep them as lustrous and as white as long as possible. But you just can't go through decades and decades and decades of green tea and coffee and stress and not think your teeth aren't going to start to look older. They will, and like I said, I know.
And you're going to do it in a holistic way.
Right, we're going to do all porcelain materials, no metal, no graying at the gum line, the most natural adhesives that there are that actually promote regeneration of tooth structure. And yeah, they're going to look, I tell people, don't, make them a little transparent. Don't just go for paper white. People sometimes want that, but I try to help people make them a little transparent, make them a little see-through, make a little different shading at the gum line. But yeah, because you don't want people to be like, oh my goodness, look what they went from dingy teeth to bright white pieces of chiclets in their mouth. But you want to be able to smile naturally and feel the way people are feeling better longer these days. So you still want to feel young and vibrant. And like I said, I know, sign me up. I'm going to be there.
I hated my smile. Whenever there was a picture taken, I always wanted to be the photographer and never in the picture. If I absolutely had to be in the picture, it was either a closed smile where you really didn't see my personality, or I had to be on the left side. So I would run to the left side of the group picture because I hated my right side. I had a gap, and I felt like it looked like I was missing a portion of my smile. And that was always it made me very insecure. I was shocked how easy it was. I went in for a checkup, and my doctor said, hey, let's take a LumiSmile on you. And I didn't know what that meant, and it was really easy, a before and after picture of what I would look like. And honestly, I thought, shocked, like, I can't look like that. Are you serious? He said, yeah, come next week and we'll get it done. I agreed to it once he said there was going to be no shots and no pain. I said, okay, fine, let's do it. It looked so natural. Nobody knows I have Lumineers. They just know that I have a really bright smile, and that's all they say, and they compliment it all the time, and I love that. It's one of the things I actually am happy to see in the mirror. And I walk into a room, and now I'm confident to speak to anybody. I don't have to hide behind the camera. I can actually be in the picture. I can smile, and my personality can come through. I would absolutely recommend Lumineers to anybody. I mentioned it to my parents, I mentioned it to my siblings, to my closest friends. I said, go to my doctor, ask him for a LumiSmile, it's going to change your life. My name is Leslie, and having a Lumineer smile has changed my life.
I was a guy who was one of the original skateboarders in LA in the 60s. And I was coming down the slope of my driveway and bam, hit a crack and landed smack dead on my face. I thought, well, heck, I'll just keep the chipped tooth and that'll be who I am. Then I had it capped for a period of time, but there still was a gap between my teeth. I was a guy who had a gap. And I got tired of looking at that. 20 some odd years later, I decided it's a time for a change. My desire was to be, a different person. So I had it done, and it's just been night and day. All my friends and family, they just rejoiced and said, who are you? You've remade yourself. Lumineers have changed my life. As a salesman, you need a smile that wins. And when I got my gap taken away, had my teeth done right, wow, what can I say? Everything increased 100-fold. This was a natural fix. And I tell you, I just couldn't imagine. My wife is jealous because all the women are looking at me now. I'm Robert, and I've had 4 Lumineers. It's the smile that wins.
It's no surprise that periodontal disease is so prevalent. It really is caused by a bacterial infection that you can't clean very well at home.
The toothbrush, great tool, but it can only get a couple millimeters below the gum tissue. Same with flossing, doesn't get much further than that.
The problem with toothbrushes, rinses, and flosses is that they work on the surface. They do not work below the gum line.
When you have bleeding gums and you have subgingival tartar and bacteria, just brushing and flossing isn't going to treat the problem. It needs to be attacked subgingivally or underneath the gum tissue.
You cannot control all the bacteria. You don't kill all the bacteria. But what you do is you change the microenvironment.
So between the tooth and the gums is where the bacteria hide. And as soon as they grow into a colony, a community we call a biofilm, it's really difficult to manage it. So that's why the perio tray is nice. The tray gets medication really deep under the gums where you need it, where your toothbrush, rinse, and floss can't reach.
The depths of the pocket are very difficult for not only the dentist to get to, but for the patient to treat with almost any other method.
The tray is a delivery device. The tray is like a syringe that delivers insulin for a diabetic. It's the insulin that helps the diabetic. The tray just delivers the doctor-selected medication down into and holds it in that infected area long enough for the medicine to work.
And the tray is unique. It's unique for you. So your dentist or hygienist will take measurements in your mouth and send that to one of the dental laboratories, and they'll create a tray with an internal peripheral seal. And that internal peripheral seal corresponds to measurements from your dentist or hygienist, and it's made for every single tooth. That seal corresponds to your unique conditions. And that seal and the extensions beyond it work like a gasket. They prevent the medication from leaking out all over the mouth, and they direct it very deep into the periodontal pocket.
The action of the periodontal gel causing a positive pressure in the tray forces that medication to the bottom of the sulcus, and we will get treatment all the way down, whatever their depth may be.
In the beginning stage of treatment, you're going to be asked to use the trays 2, 3, or 4 times a day. And that is because each tray application is going to work against that bacterial community. So imagine it's like an onion, and you're applying the medication with the perio tray deep into the pocket. You're going to peel off that onion. Next application, peel off the onion. Pretty soon, your body has a chance to heal because you're fighting that bacterial community. Then long-term use, for most patients it's 1 time a day, 10 to 15 minutes. Long-term use gives you a way to manage the bacteria on an ongoing basis.
These trays are needed so that the patients can have them at home to do on a daily basis, take their health into their own control, and really get that medicine down to where it's needed.
You want a healthy oral flora, and this is what the tray delivery is going to be able to help you accomplish.
What if we told you there was a more natural way to achieve straighter teeth and well-developed jaws? Well, one company is doing just that and taking a preventative pre-orthodontic approach to setting up children for a life without braces.
This is not your typical dentist's office. It's a MyoBrace pre-orthodontic center, and the children who are here are learning an innovative approach to dental care and development. Modern research has shown that crooked teeth may not be genetic, but rather a result of bad oral habits started in early childhood that prevent proper jaw development. MyoBrace treatment involves wearing a series of oral appliances that correct breathing function and retrain oral habits. These are worn for 1 to 2 hours each day and overnight while sleeping. MyoBrace is now being used in over 100 countries worldwide. So if your child is showing symptoms like breathing with their mouth open, or perhaps they're having restless sleep, MyoBrace might just be that natural solution you've been looking for.
Hi there. My name is Andrea.
And I'm Ben.
And today we're going to learn about some fun ways to help you get straight teeth and grow your jaws.
We now know that when we start to see signs of crooked teeth, it usually means the jaws aren't growing properly. Bad oral habits, like not swallowing the right way and breathing through your mouth, are the main causes of the crooked teeth and jaws. The forces of the tongue, cheeks, and lips combined with these bad oral habits can have a big effect on how your teeth are positioned, as well as how your jaws grow. A normal top jaw grows properly because the tongue rests in the correct position, which is in the roof of your mouth, known as the correct tongue resting position. If your tongue does not rest in the roof of your mouth, the top jaw will become too narrow, so teeth won't have enough room to grow straight.
Another thing to watch out for is if you're swallowing the wrong way, with lots of movement in the bottom lip. When this happens, your front teeth will be pushed backwards, and this also causes your teeth to be crowded. Your MyoBrace, as well as the MyoBrace activities we're going to talk about, will help you fix those bad habits so your teeth and jaws can grow the right way. If you have a look at this boy, you can see what happens when we change from an incorrect tongue position to the correct tongue position. Once those bad habits have been changed, you can notice the difference straight away. So, how does your MyoBrace work? The MyoBrace appliances work by teaching your tongue to rest in the correct tongue resting position. Breathe through your nose normally and swallow the right way.
MyoBrace activities help this by stretching, strengthening, and retraining your tongue, lip, and cheek muscles, as well as improving the way you breathe. If you can control where your tongue is positioned and the way you breathe, then your treatment time will be shorter, your teeth will naturally become straighter, and your jaws will develop the right way.
The MyoBrace is a very important part of your treatment, and it needs to be worn every day for 1 to 2 hours and overnight while you're asleep. You can wear it while you're getting ready for school, doing homework,
playing games, or even while you're watching TV. It can't straighten your teeth all by itself though, so it's important we help the MyoBrace do its job by completing certain tongue, mouth, and breathing activities. If you're wearing your MyoBrace as well as completing the MyoBrace activities every single day, you'll be on the fast track to making your teeth and jaws grow correctly. If you want your teeth to be straighter and your jaws to grow the right way, you need to be prepared to put in the effort and do your MyoBrace activities every day. Remember, those bad habits didn't appear overnight, so it may take time to train new ones.
By working hard and altering bad oral habits, you will get great results, but it's up to you to make the change. If you want to know more, you can talk to your MyoBrace educator or check out myobrace.com.
The MyoBrace is a new concept in orthodontic treatment, incorporating high-tech design characteristics to align the anterior dentition and the mandible into Class 1. This flexible appliance features individually sized tooth slots and dynamic core, the active inner core enabling controlled arch development. The MyoBrace is suitable for most children currently in the mixed or permanent dentition requiring orthodontic treatment. MRC continues to lead the world in the application of advanced design technology within the field of intraoral appliances for orthodontics and TMJ treatment, and remains at the cutting edge of dual-molded appliance technology.
It's important to understand how the MyoBrace works. The MyoBrace shares some functional similarities to conventional braces. The flexible preformed hard inner core simulates the forces of arch wire, while the soft outer silicone material engages the teeth just like an orthodontic bracket. It's this combination that helps to align the teeth in the late mixed dentition, and this is why the MyoBrace has a major advantage over older positioners.
In addition to the regular MyoBrace, there have been 2 special variations developed based on feedback and research. The NBN was introduced to widen the adaptability of the MyoBrace system to allow treatment of more severe malocclusions. The NBN lacks the inner core of the regular MyoBrace, but can be very useful for initial treatment where the arch form is already developed. The MyoBrace Starter, or MBS, is designed for initiating treatment in more severe cases with narrow arches. The MBS comes without tooth slots, but features Dynamic Core, which provides moderate arch expansion and improves arch form without being too concerned with precise tooth positioning. Unlike other positioners, the NBN, MBS and regular MyoBrace feature 3 key characteristics carried over from the already well-established trainer system. The tongue tag, to actively retrain the tongue into the correct position. The tongue guard, to stop tongue thrusting while in place and also allowing for a natural tongue position. And the lip bumper, to discourage the overactive mentalis activity associated with a reverse swallow. These features greatly assist with the important myofunctional component of cases requiring Class 2 correction.
Due to the nature of removable appliances, patient compliance is essential. Therefore, it's important to select motivated patients and parents. If motivation is a problem, it may be better to stick to conventional fixed brackets. In children aged 10 to 14, the MyoBrace has proven to be a viable alternative to conventional orthodontics. No matter who you ask, children prefer to be treated without brackets.
The MyoBrace combines dental alignment, active arch development and myofunctional training in one easy-to-use appliance system.
Comfort isn't something you should compromise on when it comes to your mouth, so don't. Our process starts with your dentist or orthodontist, where they scan the shape of your teeth, decide how they should move, and send us a written prescription. We create a series of aligners ranging from crooked to straight. From there, the aligners get boxed up and shipped to your doctor to ensure they fit properly. Your job is to wear each aligner all day and night, except while eating, drinking, and brushing your teeth. It's important that you wear them at least 22 hours a day, or the straightening process will stop. When the process is halted, it takes longer for it to start up again, prolonging your treatment. Over time, as you switch out each aligner for the next, light pressure is applied to certain teeth to gently move them to the desired position. And since they're clear, most people won't know you're wearing them. Get ready for your perfect smile. It's only a few aligners away.
So you offer even metal-free dental implants.
Yes, and this is something that has been, I've been doing implants a while. 15 years, the titanium implants, very, very, good success rate. But there was aesthetic drawbacks to them. And there's also whole body drawbacks to them because some people have sensitivities to metal. They have other metals in their body. So there were some drawbacks to them. People would smile, and it's great they have the tooth, but now the area above the tooth looks gray because you can see the gray implant.
Right? Okay.
So when it comes to replacing teeth in the smile line, there's nothing better than white. I mean, people love white. Everyone wants white teeth, white clothes. People love white in their mouth. So instead of having gray along the gum line and gray underneath the gum line where they had teeth replaced, now it's just natural. All you see is a white tooth because everything underneath the gum tissue is free of metal.
And even for the denture wearers, you're able to get people use these implants. So it's not just for single teeth.
Right. It's not just for single teeth, but what got me so interested when I first started to see them. And they started first in Switzerland and Germany, so I had to do a lot of research over there, and I was like, oh my gosh, I'm like, perfect, this is what I've been waiting for. Like, there's nothing I hate more than giving a person a tooth back and it not looking just like a tooth because theirs is graying. But now they're finding from a biocompatibility and a whole health standpoint, people are starting to realize how everything in their mouth affects their whole body. So to have this option to use indenture wearers just, again, continues to make the entire body. Now they can chew and they can eat and be healthy. They can emotionally be healthy because they're confident.
So is there a crowd, like, for example, the Whole Foods crowd? I have a co-host. She's involved in a lot of this, doesn't like metal anywhere. But is there a crowd of people that are like, want this?
Absolutely.
They're looking for this?
There's a lot of people.
And they don't know who to go to?
Right. I give them, like I said, we're already talking to people, but right, there's a lot of people who have no idea the options out there, or they come in and, you know, sometimes I get them from maybe a naturopathic doctor or a nutritionist, you know, someone that's mentioned, well, I think you can get metal-free implants now, because whether or not you have an allergy to metal doesn't mean you want to be without your front tooth. You know, like, the people want to do something, and so they come seeking an option like this, and it's amazing. I'm so glad.
So they work?
That is,
they're strong?
Yeah, they actually are just as successful as the titanium ones. With the current research, they have showed the same success rate.
And they're only like a couple $100 more or so?
That's it. That's what they're not that much more expensive. And people always think success too, like people are worried about success rate with implants. I always tell people it's the second most successful thing I do in dentistry. And the first most people want. You know what the first is?
No.
Pulling teeth. It's pretty successful.
Works every
time.
time.
It works every time. It's a charm. But yeah, so it's actually the second most successful thing I do.
Meaning they don't fall out. When you say, is that what you're determining success by?
Right. Success, people look about meaning it lasts you a lifetime. Think about fillings. I've had the same filling done 3-4 times already, and I'm only, like you said, 22. So that stuff, even fillings, they're great, but I know even the best filling doesn't last. The best crown lasts a while, a few decades maybe, but there is nothing more successful
so get
in my practice.
If you are missing a tooth, your message,
implants and,
get dental implants.
Yeah.
No
be done with it, right?
But what if you already have, they say, well, my bridge is fine. You know, would you say, come in, get a consultation, maybe get rid of that bridge and do a dental implant?
If
or
you want to,
keep the
again,
bridge?
I'm a very minimalist in treatment and conservative. I actually don't want, my goal in my practice is to have people not need treatment. But the problem is there's a group of people that want, you know, they got their teeth taken away from them prematurely. So I know I can give them back. So they're my passion to give them back. And then all the other half of my practice, it's the people that I never want them to have to do anything else. If a patient does have a bridge that's intact, I don't want them to do anything unless they want to do something. If they have, a lot of times they have the old metal bridge underneath, so they hate that it's gray. They smile and all you see is gray. They're begging me to take that thing off. Anyways.
Do you think these, I want to ask you this question, do you think, because I have an acupuncturist buddy, do you think the meridians or the chi, that the titanium implants might be throwing off the chi a little bit? Or are there people with that belief?
There's probably people with that belief. Titanium is a pretty biocompatible metal, and we do actually even offer biocompatibility testing in our office to see if you are allergic to titanium. And believe it or not, the vast majority of people aren't, actually. So there are plenty of people that, you know, can use titanium in their body and not have a problem with it. But there are individuals, especially individuals that have had certain conditions, that have certain types of neurological conditions, seizures, etc., that their doctors just recommend metal-free.
But the hardcore holistic crowd, this ceramic is not a metal.
Right. It is not on the periodic table as a metal, and that's what distinguishes it to having those electromagnetic reactions within our body.
So you love these implants?
Yeah, like I said, I love the way they look.
Let me see
show
them how small it is.
This small and this strong.
And that's a big one, you said.
Yeah, that's a big one. This is a molar. Yep, this is a molar. So again, most people don't even need this big of an implant.
So you're missing a tooth. Fabulous. Come in, get it done, same day. Doesn't hurt.
A tooth pulled back.
Doesn't have to hurt.
It doesn't have to hurt. Yeah.
Right.
So I tell people mild soreness. If you've had a tooth pulled, you're going to experience the same soreness but less.
What are the options when a denture wearer goes to your office as far as dental implants?
Well, a lot of times I go through the options based on the fear that people have, because people are scared that it's going to be expensive and that they're going to hurt to get implants. So I start off with the easiest thing. There is something that you can be in and out of here in 60 minutes. You'll feel like you just maybe bit a Dorito wrong in your gum, and that's it. So we just place 2 implants, just 2, to secure your denture into your mouth. So that is the easiest.
So it's a snap in, snap out.
And it clicks. And when I mean clicks, it's done. You have to, some people actually can't even get out our removable click-in denture. It's hard for them to click out. That's the first thing they say to me. They're like, I can't get it out, I can't get it out. I'm like, it's going to take practice. But that's the easiest option for people that are a little skeptical. Of course, people want to eat really, really, really good food. Granny Smith apples, nuts, steak, corn on the cob. So you can give it a little more stability by getting 4. I tell people it's like a table with 4 legs. 4 is nice and stable. You're really going to get improvement. So 4 implants is an option for denture wearers. And then there are the denture wearers that would be happy throwing their dentures out the car window. They want the actual dentures to be adhered to their mouth permanently. And the options that we have there is placing a few more implants, normally only another 2 to 4, so you're looking at 4 to 6 implants in an arch, and then you can actually screw or cement the arch of teeth into the mouth. And then you don't have to be worried about taking them in and out.
And then they just go see you as a dentist, like what, a couple times a year?
Yep, 3-4 times a year for a cleaning. Yep, they can
use
a water pick at home. They're back in the system. They can buy all those nifty Sonicare air flossers. They can floss with air. No more string floss. Times have changed, and so that's easy for them. They just take their air flosser, clean out around them. No more ulcers. No more goo trying to keep it in there. No more relining. Sometimes they go back to the dentist over and over, and they spend all this money trying to get the denture to fit again, and it just never fits because the bone is always deteriorating until the implant is in there. Once there's an implant, your body keeps the bone because it's like, I need to hold these things on. So it's just a win-win.
If you have lost a single tooth, you have various tooth replacement options to consider. One option would be a single-tooth partial denture. A major consequence of this option is the bone loss that occurs due to the absence of the natural tooth root. Biting forces will cause the partial to move and shift because its design lacks a secure connection. Many partial denture wearers may also experience discomfort and gum irritation. In a second option, known as a resin-bonded bridge, a high-speed drill is used to cut into the back of the neighboring teeth. A prosthesis is then added to the back of your natural teeth. With the absence of the natural tooth root, the bone above the crown begins to shrink. Everyday biting forces will also begin to apply opposing pressures that will loosen the bond over time. The third option is referred to as a fixed bridge. A high-speed drill shaves down a significant amount of the neighboring teeth's natural structure. This prepares the teeth for the fitting of a fabricated 3-unit bridge that is cemented in place. However, bone loss soon occurs, and plaque buildup is common below the margins of the crowns. The neighboring teeth lack adequate tooth structure, which makes them weaker and more susceptible to tooth decay. Tooth decay leads to root canals, and a root canal can eventually cause additional tooth loss. The bridge can be repaired by the preparation of an additional tooth and the cementing of a 4-unit bridge. Additional bone loss occurs, and there is still consequences of additional tooth decay and root canal disease that may lead to another failed bridge. The fourth option replaces the natural tooth root with a dental implant that is inserted into the bone. An abutment is secured to the implant, and a crown is secured to the abutment. The dental implant option closely mimics the design and function of your natural tooth. The dental implant is the most secure option, with a solid foundation of bone that keeps it stable, withstanding the forces of biting and chewing. An implant feels and functions like a natural tooth, and it is proven to outlast all other tooth replacement options.
What is microneedling with MD Pen? Microneedling, also referred to as collagen induction therapy, creates a pattern of microchannels in the skin. Under the skin, the microchannels initiate the body's natural healing process, causing an increased production of collagen and elastin. On the surface, the channels allow for the absorption of serums, hyaluronic acid or PRP, if used during treatment. The result is smoother, fresher, and more uniform skin. The art of healing the body by applying needles dates back centuries with acupuncture. Today, this art is perfected in motorized microneedling with MD Pen. MD Pen microneedling treatments transform common skin problems, including acne scars, fine lines, photoaging, stretch marks, and poor texture, leaving skin smoother and firmer. Now, many skin imperfections that might have been treated with more aggressive lasers or IPL can be addressed with a series of safe MD Pen skin needling treatments. MD Pen treatments are non-ablative, do not cause trauma to the skin, and are a safe, effective tool in an anti-aging skincare regimen. MD Pen is the most powerful microneedling device on the market, moving at over 13,500 RPM during treatment. Its rapid speed reduces drag on the skin, minimizing damage and discomfort. MD Pen creates 15,000 microchannels per square inch, and when moved in the signature MD Pen crosshatch method, yields maximum coverage. This means more collagen production, increased absorption of hyaluronic acid or PRP, and ultimately smoother skin. MD Pen is constructed from stainless steel, providing durability and dependability. MD Pen features a 32-gauge stainless steel needle set in a sterile needle head. This offers a controlled skin penetration depth of 0.25 millimeters to 2.75 millimeters, allowing for a wide range of treatment protocols. There are 2 needle options to customize the treatment to the needs of the individual patient. The refined needle features 160 mini microneedles and is ideal for performing more superficial treatments. And the Restore needle has 12 standard microneedles and is suitable for treatments on all face and body areas. Studies have shown that microneedling is an effective skin restoration treatment. Using your body's natural cellular regeneration, it's a safe way to tighten, smooth, and lift the skin. To learn more and to see treatment videos, visit us at mdpen.co or speak to your MD Pen practitioner today.
Ever since I remember, I've had headaches. When I was early teenager, I noticed that I started having a lot of jaw issues, lots of clickiness, locking, always sore. And so I started, my mom took me when I was younger to just my family practitioner because my headaches were so severe, and they just tried different medications. They'd say, try this migraine medication for this long, and that didn't work, so they'd switch it to another one. That didn't work, and things would mask the symptom, but I don't think anything ever truly went away. I ended up having brain scans because they thought maybe I had aneurysm or some kind of clot, and all of that stuff came back clear. So there was nothing there, and they just say manage your stress and whatever, and take these or take these, and it's just was never a long-term solution. My mom found me, you guys, here and said, why don't you give it a shot? You've got nothing to lose. So I decided to try it out, and I've been coming for probably 7 weeks maybe, and I've noticed a huge difference. When you deal with headaches all the time, you just don't want to go out. You don't want to be surrounded by loud things or lots of people, or be out for a long period of time, because it just triggers things. And I could get thrown into a headache for days and it just wouldn't subside. And now this moment things happen, I can put on my earbuds and I can take it in my car, and I can take it with me on trips. I've been on several vacations since I started here, and I've had no problems taking it through airports, and I can do anything. And I know that even if something does happen, it's right there with me. And I'm doing so much better. I sleep so much better, and I feel like I've really noticed a difference.
It felt like when I woke up in the morning that I'd been chewing all night. And the things I would do to alleviate pain or get rid of these things would be ibuprofen, and I'd go on with my day after that. Then I'd start over the next day. I didn't know that there was an option to fix it without maybe a lot of money and reconstructive surgery, or a full mouth rehab with lots of crowns and things like that. So the first time that I came, I thought, wow, this really is going to help. As I went through the treatment, I was like, geez, that really is going to work. So just coming back week after week, there was definite improvements as we, I guess, graphed and kind of charted the progress. You could see that there was definite changes there with those things, but not only those things were changing, I felt better. And I wouldn't wake up as stressed. It didn't seem like I had a real bad night, so to speak. And I credit it to the wearing my orthotic and the things that we did for therapy. There's one big change for me. I still struggle. I'm not really a morning person, but getting up with tense muscles and a headache, or just feeling like you haven't had any sleep is huge. And since I've been going through therapy, that's changed. I kind of get up with a little bit more of a spring in my step. I'm still not a morning person, but it feels like that there's not as much tension there, and feels like I've had a better night's sleep. So that's huge for me, just being able to feel good in the morning and get my day started right. I leave work a little bit early to come to therapy, and so there's lots of people that know that I come and do this, and family as well. And it's amazing how many people have these same symptoms but don't know what to do. They just go on and try and deal with it. And I think being able to kind of educate people and let people know that there's a way to make life better and you less stressful, and is great, and that there are a lot of people out there that could definitely use this and benefit.
Hi, Dr. Debbie here, and I thank you for tuning in. Today we're at the World Symposium of the Oral Systemic Connection in San Diego, California, and I have George Hodeman with me. He is the CEO of Oral DNA Labs. For my patients that are watching this, of course, we've embraced enthusiastically the oral DNA technology to help each and every one of you get healthier, and I am very impressed with this technology, and it's been great to get to know George. George, how did this all get started?
Well, Debbie, first of all, I wanted to thank you for your role in improving patient health, and that's why we're in this business, obviously. You know, there's a large problem to be solved, and that is that over half of adult Americans, according to the American Academy of Periodontology, have gum disease. That's over 100 million Americans with periodontitis. And so the idea was to bring both bacterial tests showing pathogens in the mouth and genetic risk tests that can be used to help address this large issue.
Well, it has certainly worked in our practice. When people have a look at their profile and see which of the pathogens they have in their mouth, especially the high-risk transmissible pathogens, which in our office we call transkissable, so that really matters because you don't want to give those pathogens to your loved ones. It's really helped people to see the problem and to solve the problem, to take responsibility for their own health. So I'm very interested in just how your lab works.
Well, the science behind these tests is well established. It's been very well documented and studied that there's 11 pathogens that are well known to cause periodontal disease. 4 of these are in a high-risk category. There's several that are in a moderate risk category and also some in the low-risk category. And if you know exactly which type of pathogen exists, you can tailor and personalize therapy to more readily address the issue, which is periodontitis. So the science behind this is pretty clear. There's traditional methods of microbiology that have been used to culture bacteria and grow them and determine whether these exist or not. But now we have DNA testing, which is much more advanced. And DNA testing allows us to extract DNA from the salivary sample through a very simple rinse. And using that extracted product, we can use a PCR technique, or polymerase chain reaction, which is the state-of-the-art for DNA analysis to identify specifically the semi-quantitative levels of these microbes. And there's also a human genetic test, which we can use to look at a polymorphism, or a single nucleotide polymorphism called a SNP, in the IL-6 region, which would tend to predict whether you would have an exaggerated immune response to the presence of these pathogens.
Yes, and in our practice, we really enjoyed the genome test. When we first started using this in December of 2012, we would just get a negative or a positive response. And now we get actually a measurement, low, medium, or high, which just shows me how your lab is constantly improving on what you're doing. It's very user-friendly. I'm just very, very impressed. Is there anything else you want to tell us about?
Well, I think a lot of questions we get are, what is the back office in this? And we are a national reference laboratory, and I think what's important to know is that we're bringing the rigors of the traditional clinical laboratory to the dentistry marketplace and to the patients served by the dentists. A highly regulated, certified laboratory such as ours is under the control of a government agency called CLIA, which is an FDA counterpart. We're also certified to a much higher level, which is the College of American Pathology. So what we will do in our laboratory is use these advanced molecular techniques with highly validated test results under the supervision of pathologists and supported by genetic counselors to provide these results. So there's a team behind these two providing additional support and help. So this is the highest standard of reporting available, and it's now available to provide additional assistance to the treatment of periodontitis.
Well, and it's also helped us in many areas. In my own mouth, I got tested and found that I had Treponema dentiformis, and I ended up having a root canal that was failing. And when I got that tooth actually removed, unfortunately, but fortunately for my health, then had an implant placed, that pathogen absolutely was gone at my next test. So we can test for things, we can treat things, and we can know that we actually treated them and help the patient. And that's what we're all about, is just helping people be healthier so that they can live more happy, abundant lives. So George, I want to thank you for taking time.
And thank you, Debbie. Thank you very much for helping improve patient care.
Hi, I'm Gail Hyman, and I'm a registered dental hygienist at Goldstein Garber in Salama's office. Oral cancer is on the rise. Where other cancers have declined, oral cancer has increased over the years. So oral cancer screening in your dental practice is extremely important. Patients want to know more about oral cancer, and we are in the perfect position to provide this information. Do you realize that 1 out of 2 men and 1 out of 3 women will have cancer in their lifetime? 40% of those that get oral cancer are non-smokers, and many of them are new cases each year, of which there are 8,000 deaths. Oral cancer, early detected, can be treated. So we are going to introduce to you a procedure we're using at our office called Oral ID for early detection of oral cancer.
When we do our oral cancer examinations at our practice, they consist of a visualization or sight and a palpation or feel. So you will see Gail looking and feeling for anything that's out of the ordinary. Most lesions are caught visually, so she'll retract all the soft tissues out of the way, and you saw her sneaking my cheek out of the way earlier, and she'll continue the exam in just a moment. Or palpation, which is feeling, and which you can see Gail doing right now. She's feeling for any swollen lymph nodes or any lumps or bumps that feel out of the ordinary. Next, we'll utilize an oral cancer screening light, and that will be an adjunct to our eyes. So anything that our eyes couldn't see, this light could potentially pick up. So it's like having a second set of eyes. Anything healthy is going to glow green when you have the glasses on, which is this view, or glow blue or purple when we take the glasses off. If there's an unhealthy or cancer cell, it will show up dark, almost black. The most common site for oral cancer is the side of the tongue, so we always thoroughly examine that area when we're doing our oral cancer screening. The next most common area is the back of the throat. The best way to see that is to retract the tongue a little bit, which you see Gail doing with the gauze, is so that we can visualize better the back of the throat. When we look in the back of the throat, we examine the area around the tonsils and the area on the very back wall of the throat that's difficult to see and that doesn't often get checked by other physicians.
So we just wrapped up your oral screening exam with the Oral ID. Your tissues appear extremely healthy.
Oh, good.
Well within normal limits. You did have some plaque on your tongue, so I'm just going to remind you to do some tongue brushing. In terms of your general tissue health, everything looks like it's well within the normal limits with the fluorescent lighting.
Great.
There were no dark spots that were early indications of abnormal tissue. I would recommend that we do this screening once a year.
Okay.
So every year, this time, we'll make a note on your chart for oral cancer screening. In the meantime, if you should notice any changes on your gums or tissues, please bring it to our attention.
Great, thank you.
You're welcome.
Take a look inside your mouth at the big molar teeth in the back. You see those deep grooves on the tops and sides? That's one of the most common places for tooth decay or dental caries to begin. You can help prevent cavities from developing by brushing after meals and snacks at least twice daily for 2 full minutes. Try to cut back on sugary snacks, soda pop, and sports and energy drinks. Otherwise, what's going on in these teeth could happen to yours. If food deposits are allowed to stay in the pits and fissures of the teeth, bacterial acids and enzymes can dissolve away the enamel. Acids from food and drink can also directly dissolve enamel. Here's another place where bacterial plaque accumulates, on the sides of the teeth along the gums and between the teeth. That's why it's so important to brush the sides of our teeth as well as the tops, angling the bristle tips beneath the gums, and then flossing between the teeth every day to get rid of the fuzzy plaque. If it's allowed to remain between the teeth, you may develop cavities on the interproximal surfaces, which require the removal of more healthy tooth structure to fix. It's also where most gum disease.
I'm Dr. Gina, holistic healthcare provider and holistic and integrative dentist. I wanted to share with you a huge secret in decreasing cavities in your children if they are not good brushers and they're not flossing. I am a mother of 3 and my children have a lot of energy, are outside, and I know they are not meeting my standard of care for spending 2 minutes brushing, flossing, cleaning their tongue in the manner that I know can keep the mouth to be more free of plaque and bacteria. So there's an additional way to strengthen the teeth if they are getting combated more by plaque and bacteria that are being wiped off as many times a day as they should, and that is cell salts. I use one by Highlands Bioplasma because it has multiple kinds of cell salts in, calcium phosphorus, calcium fluoride, and if you use cell salt, or tissue salts, you will strengthen teeth and bones. Great way. I use them 2 to 3 times a day.
I've been a holistic dentist for over 2 decades. I have been talking my patients' ear off about what simple hacks and tips they can use to make their entire body healthy, only to have everyone turn around at me 20 minutes later and say, "Can you write that down?" And so I did on these for years and years and years and years and years, and thousands of patients I've written over the years, a list of things they need to pick up at the store or Amazon to become healthy, to stop sensitive teeth from needing root canals, to avoid cavities that get to the nerves, how to heal teeth they've been told needed a root canal or past infected root canals, gum disease, how to get rid of the inflammation, take care of their diabetes, their autoimmune conditions, just a wealth of everything that can go on in the mouth that causes chronic and deadly illnesses. I work with neurologists, cardiac professionals, cardiologists, endocrinologists, and just about everything. Heart disease, Alzheimer's, autoimmune diseases, all of them have an inflammatory component involved. And the mouth is a place of inflammation if not properly taken care of. So we are going to help you decrease inflammation in the mouth so that you do not have a chance or a very slim chance of getting any chronic diseases that could really not add value to your life or your family's life, and really just not allow you to enjoy life. And we also, of course, will discover the aesthetic parts of the oral cavity, because I know everyone wants natural and holistic ways to keep the teeth white, the gums healthy, and so we'll go over those too. We want to make sure that your smile is beautiful as you're being healthy in this way.